Today we will have two lectures. One lecture today we'll have it, and tomorrow we'll have another lecture regarding viral skin infections in relation to the MSS module. The learning objectives, there are many viruses that can infect and cause skin diseases. In particular, in childhood, there are 6 diseases that we are going to talk about them. These are called exanthemes with skin eruption. Besides, we are going to talk about warts, الثالول, smallpox, monkeypox, and herpes viruses, inshallah, next lecture. What we are going to talk about these microorganisms, we are going to talk about pathogenesis, clinical picture, diagnosis, differentiation between these viruses. Starting with childhood exanthemes. What is the meaning of exanthema? Breaking out, that is to say, rash in childhood diseases. Classically, there are 6 types of exantheme diseases. They are numbered 1, 2, 3, 4, up to 6. 4 of them are viruses. 2 of them are bacterial. The bacterial, we are going to deal with them, or we have dealt with them in other systems. But regarding the viruses, we have only 4 viruses which can be considered as exanthemes. First of all, measles, and you know what's the meaning of measles, al-hasba, which can be called rubiola. Another name for measles, not commonly used, called rubiola, is the first disease caused by measles virus. The second disease is called rubella. What is rubella? Is the German measles, al-hasba al-Almaniya, which is considered third disease caused by rubella virus. ممكن واحد منكم يسألني لعد السكند وينه؟ السكند is bacterial, which is scarlet fever, الحمى القرمزية, which is caused by Streptococcus pyogenes. We are not going to deal with it. We have dealt with it with other systems. The third disease is erythema infectiosum, which is called the fifth disease, which is caused by parvovirus B19. And we are going to talk about these viruses one by one. And you may ask me, where is the fourth one? The fourth one is bacterial disease, which is caused by Staphylococcus aureus. The fifth disease is called erythema infectiosum. As I said, parvovirus. The last one, the sixth disease, Rhizola infantum, which is caused by human herpes virus type 6 and type 7. These are the exanthemes. So I would like you to know what is the first disease, what is the second, what is the third, and up to the sixth. And you have to know vice versa, the name and the number. Starting with the first disease, measles, al-hasba. And we call it rubiola, as I said, and we can call it hard measles. It's acute, highly communicable, very communicable. A child in a house may spread the infection to other children. The patient will have fever, conjunctivitis, cough, photosensitivity, and the most important thing, goblet spots. These are present. These are the goblet spots. You can see them. These are present on the inside of the cheek, في داخل الفم. على اتجاه الخد. Okay, called goblet spot. What are these goblet spots? These are small red spots with a bluish white center dot in the center of the spots. This stays very shortly and disappear. The rash on the face start 3 to 7 days and then become generalized all over the body. It is caused, this disease, measles, caused by single-stranded RNA virus, which is called measles virus, which is negative sense virus. And you know what is negative sense virus? An envelope virus. This is the structure of the virus. Just have a look at it. We are not going into the details of the virus. It is enveloped, yes, it has envelope around it, and the nucleocapsid, this is in the central, and it has spikes also. So this is the measles virus. This child started on the face, as I said, and then spread all over the body. Although nowadays measles, because of the vaccination of children against measles, rarely we see it, except in those children who are not vaccinated. The pathogen of measles, called measles virus or rubella, the family of it paramyxoviridae. ممكن واحد يسألني دكتور نحفظ هذه أسماء الفاميلي؟ لا, it's just for your knowledge. We are not going to talk in such things. You are doctors. But you have to know the family is paramyxoviridae. Single-stranded RNA, as I said. The reservoir is in a human, not animal virus. Spread by airborne droplets or direct contact with nasal and throat secretion between children. Incubation period is 10 to 14 days, 2 weeks, around 2 weeks, from exposure to rash appearance. This is the incubation, from contact with another patient until the rash appears. Diagnosis, clinical, of course, just straightforward, and epidemiological. Epidemiological, we know that there are cases, especially during winter. Molecular, like PCR, cell culture of the virus, which is not done routinely. Complications of measles, there are many complications. That is why vaccination against this disease is very important. It can lead to bronchitis, pneumonia, otitis media, التهاب الأذن الوسطى, الأذن الوسطى, middle ear, encephalitis, subacute sclerosing panencephalitis, التهاب الدماغ, which comes late, years later after measles. The patient will have psychoneurological manifestation, that is to say personality change, seizure, photosensitivity, ocular manifestation, and may have coma. Psychoneurological manifestations. What about vaccination? There are 2 types of vaccines. MMR, اللي هو اللقاح هذا, mixed measles, mumps, and rubella. mumps يعني النكاف. rubella الحصبة الألمانية. Can protect against measles, mumps, and rubella. We give 2 doses from children for children 12 to 15 months. يعني طفل عمره سنة وثلاث أشهر نعطيه vaccine, وanother booster dose من يخش المدرسة at 4 to 6 years. Another vaccine, the same vaccine, but with it chickenpox, varicella, V, MMR-V. What is V? Varicella. الجدري المائي. To protect against measles, mumps, rubella, and chickenpox. Both can protect these two vaccines or protect for more than 20 years. Very effective vaccines.
السلام عليكم. ازيك يا دكتور زين؟ ازي حضرتك؟ معلش بس أذن حضرتك بس المحاضرة. أنا المحاضرة بتاعتي بدأت من ربع ساعة.
دكتورة دعاء.
مع حضرتك.
أنا كأنه أنا محاضرتي على 9.
لا حضرتك الساعة 8. أنا الساعة 9.
طيب ممكن أعوضك بمحاضرة ثانية عنها بكرة مثلا الساعة 8 أو 9.
طيب أشوف كده ثانية واحدة.
لأن بديت بالمحاضرة متأسف. أنا كان فكري أنه محاضرتي على 9. سوري about this.
لا مفيش حاجة. خلاص حضرتك بكرة الساعة 8.
أنا بس بعد المحاضرة أتصل فيكي.
طيب
أرتب معاكي موعد.
خلاص ماشي.
شاكر لإلك. I'm sorry. German measles, another lecture, another virus, German measles, rubella, which is mild, يعني الحصبة الألمانية, which is mild, febrile, viral disease. The skin lesions, fine, pinkish, flat rash, start 1 to 2 days after the onset of the disease. Start again on the face and neck, then spread to the trunk, arms, and legs. In the first trimester of the pregnancy, لو يحصل الجيرمان measles في بداية الحمل, it can cause congenital rubella syndrome. What is congenital rubella syndrome? Fetus death, abortion, malformations, تشوهات خلقية. ولهذا السبب يعني البنات يجب أن يلقحوا ضد الجيرمان ميزلز قبل سن البلوغ لحمايتهم من الإصابة في فترة حمل قادمة. Because this virus can cause congenital rubella syndrome. Incubation period is more than 2 weeks, 16 to 18 days. This is the rash is milder than the measles. It's not as intense as in the measles. أخف شوي من الميزلز. The pathogen of rubella, the virus, rubella virus, is called rubella virus. The family Togaviridae. أيضا إن شاء الله بالفصل الثاني راح ناخذ معلومات عن التوغافيريدي. Single stranded, positive sense virus, reservoir again human. This is the structure of the virus. Just have a look. It's single stranded, right? It has envelope. I don't want this structure from you. The transmission droplet spread, direct contact, nasopharyngeal secretion, similar to the way of measles transmission. Laboratory diagnosis, immunodiagnostics, molecular, and cell culture. Erythema infectiosum, causative agent. Erythema infectiosum, the causative agent is called parvovirus B19. So remember, erythema infectiosum, parvovirus, B19. Single-stranded DNA now, not RNA, DNA virus. It has a 3 capsid protein, VP1, 2, 3. Most of them, VP2, represent 90%. This virus replicates in the erythroid precursors في الخلايا البدائية اللي تكون الار بي سي لاحقا called erythroid precursors attached to the receptor of P blood group P, one of the minor blood groups is called P. I'm sure you have heard about the P system in your previous studies. This virus, the parvovirus B19, can cause what is called slapped cheek syndrome, slapped face, وكأنما الطفل يعني حرام مضروب على الخد, called slapped cheek syndrome. وممكن نشوفها بهاي الصورة. شوف كأنما this is erythema infectiosum. شوف الخد كيف أحمر كأنما مضروب على الخد. Initial the prodromal phase يعني المقدمة للمرض, fever, runny nose, headache, cold-like, flu-like. It is very infectious during this stage to other, including the care workers, يعني nurses, في مدرسة, في حضانة. الناس العاملين ممكن ينعدوا من الطفل. The rash is a bright red, itchy. Look to this characteristic. Is itchy rash on the face mainly, on the cheeks, spread to other area. And during the rash, the disease is not infectious. So it is infectious during the prodromal, the initial stage, while once the rash appears, is not anymore infectious. In incubation period, 4 to 12 days, a transmission, secretions, again, respiratory route, and through the blood. Why the blood? Because it's attached to the erythroid precursor, to the P blood group receptor. Complications for the fetus, if the mother is infected during a pregnancy, hydrops fetalis, يكبر الرأس during the embryo, miscarriage, الإجهاض, sickle cell crisis. You know sickle cell anemia and sickle cell crisis. A plastic crisis in a chronic hemolytic anemia. If a patient have a chronic hemolytic anemia, he will have a plastic crisis. HIV and AIDS will have anemia, severe anemia, if they have this viral infection. Again, autoimmune diseases of the joints and connective tissues can be complication of this viral infection. Diagnosis, DNA probe, genetic, or PCR. Again, antibody-specific test using ELISA, for example, may be a good test to diagnose erythema infectiosum, detecting IgM, which is the acute stage antibody. A treatment, there is no specific treatment, is symptomatic, supportive. Patient under fever, you give him antipyretic and so forth. For immunocompromised patient, you may give him immunoglobulin as passive immunity مؤقتة, temporal immunity, just to help the patient who is immunocompromised, ضعيف المناعة. Recombinant vaccine, which is called VLP, what is VLP? Viral-like particles, is under study. We hope that we will have such a vaccine in the near future. This is erythema infectiosum. The other disease, which is Rhizola infantum, sometimes called exantheme subbitum, subbitum means sudden rash. Common in children between 6 months and 4 years. So it's childhood disease. ولهذا السبب تسمى infantum, children. It is caused by herpes viruses type 6 and 7. Mainly type 6, A and B are major causes for this condition. The patient will have 3 to 5 days fever, then followed by faint transient rash خفيف. Treatment supported. كونها بالchildren, الpatient عنده fever. Remember, don't give aspirin for children, which can cause Reye syndrome, which affect the brain, can cause brain damage. If you give aspirin to children for fever, it can cause brain damage. Also, antiviral drugs, Jancyclovir, Valcyclovir, may be used. If the condition is severe, you can use these anti-herpes. Jancyclovir and Valcyclovir are anti-herpes drugs, which affect the herpes viruses. And we will talk about these drugs next lecture, inshallah. This is Rhizola infantum, very faint rash, very small rash. We finished with the exantheme diseases. We will talk about warts, الثالول. It's skin and mucous membrane lesions, so we can see warts on the skin and on the mucous membrane. And there are 3 types of warts. Verruca vulgaris, which is the most common, venereal warts, and we will talk about venereal warts when we will talk about UGS system, urogenital system, inshallah بالفصل الثاني module UGS. And the plantar warts اللي تظهر على القدم, plantar. So verruca vulgaris, venereal warts, and the plantar warts. Most of these warts are harmless. Remember that. However, some of them may cause cancer, may be cancerous. So that is why we have to pay attention to them. Pathogens of warts is HPV, a human papilloma virus. It's very important virus. It has 70 types. Family, Papovaviridae. The genus papilloma virus, or from the name papilloma virus. Double-stranded DNA virus. Reservoir in a human being. The transmission, direct contact. Sexual, genital wars are very contagious. معدية جدا. Contagious معدية. Diagnosis usually clinical. Once you see it, you are not going to forget about it. A human papilloma virus, we will come back to it when we talk about the UGS, because one of the important causes of cervical cancers in women. So we will talk about it بالفصل الثاني إن شاء الله. Human papilloma virus, we said, is double-stranded DNA. It is a relatively small virus. The capsid of the virus, the capsid, contain 2 proteins, L1 and L2. That's it. So it has circular, double-stranded DNA, and the capsid of the virus contain two structural protein, L1 and L2. That's it. This is under EM microscopy. It's rounded virus, spherical virus. The other virus, smallpox. Smallpox الآن eradicated from the earth from 1980. من سنة ال80 السمول منتهي في العالم. But as a doctor, you have to study it. Sometime we may have a break, لا سامح الله. أحيانا this smallpox can be used in weapons. Systemic viral infection can cause. So you have to know basic knowledge about smallpox. It can cause fever, malaise, headache, prostration. Prostration معناتها تعرق. Severe backache and skin rash. And we have to differentiate smallpox from chickenpox, الجدري المائي. Smallpox and the skin rash. Chickenpox, it has a skin and a mucous membrane lesions. So they are similar in appearance sometimes. Although I said there is no smallpox patients nowadays. والسمولبوكس كان في لقاح. لو تشوفوا مثلا الأمهات الكبيرات في السن أو الأجداد الكبار في السن، تشوف في ندبة نتيجة اللقاح على الفور آرم، على الساعد. هذه كان سابقا يعطوا لقاح للسمولبوكس. It can cause bleeding to the skin and the mucous membrane and lead to death. So you have to know such a thing. The pathogen of smallpox can cause, is called variola. So we have variola minor and variola major. Variola minor sometimes is called alström. Fatality less than 1%. Variola major fatality is quite high, 20 to 40%, up to 50%. Caused by double-stranded envelope virus, family Poxviridae, or smallpox, Poxviridae. Genus Orthopox virus, potentially very dangerous virus. This is the virus. I don't want the structure except the shape. It has two lateral bodies. Look, this is lateral body, two lateral body. It can cause curve-like appearance from both sides, this lateral body. So once you see this picture, due to the lateral bodies, you will say this is the structure of pox virus. Diagnosis clinical, you have to distinguish it from chickenpox. Cell culture, virus neutralization test by antibodies, molecular EM, electron microscopy. Of course, the test for smallpox should be done in biosafety lab, very strict lab. It's called biosafety level 4. يعني مو في كل مختبر تجرى هذه الفحوصات لأنه very infectious, very dangerous. Although we don't have, but you have to know the knowledge. Monkeypox, هلا واحد يسأل دكتور ليش احنا ندرس المونكي بوكس؟ شو علاقتنا؟ احنا أطباء. This monkeypox can be used in the vaccine against smallpox. يعني اللقاح اللي ضد الجدري هو monkeypox. Is a rare viral disease, milder than smallpox, caused by monkeypox virus, orthopox virus, the transmission to animals, but a human may get it also. Diagnosis, immunodiagnosis. molecular, of course, EM, and cell culture. All of them almost the same. Once you talk about virus, which has very ultra structure, you have to talk about EM microscopy, and microscopic electronic, immunodiagnostic. Antibodies, of course, will be useful. Molecular, like PCR, cell culture. But remember, sometimes certain viruses cannot be cultured. This is the monkeypox in a child, the appearance of it. But the important thing that you have to remember is this one. The virus is used in the smallpox vaccine. I think I have to stop here, and I will leave the second lecture for tomorrow, inshallah. And I will tell your CR what arrangement we are going to do. ممكن أن تبقوا عشان أرن على دكتورة دعاء، جايز تستفاد من الوقت المتبقي. Okay, any question? Any question? If not, we are going to leave the meeting. See you next time. Goodbye.